those exercises need to be prescribed. We need to think of them as a specific treatment, much like a drug needs to be prescribed by your veterinarian, and exercise should be prescribed by your physiotherapist. It's important not to underestimate the importance that physiotherapy can play in our pets. After all, if we have an injury, if we hurt our joint, if we strain a muscle, often the first step is to consult a physiotherapist before we see our doctor if things aren't getting better or if our physio advises it. So why should physiotherapy play any less of a role in our pets?
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hello, and welcome to episode number 67 of Call the Vet. If we've not met before, then my name's Dr. Alex. I'm the veterinarian behind ourpetshealth.com, and on this show I answer all of your dog and cat health questions, whether it's how to keep them healthy in the first instance, if they've been injured, if they're sick, then what that actually means, what the options are, what the treatment is likely to be. Whatever it is, I'd love to hear from you. Just head over to callthevet.org and you can submit your question for an upcoming episode. But before we get into today's show, I just wanted to kind of paint a little picture of what it's like here at Call the Vet, Our Pets Health HQ. It's freezing cold. We're kind of well into the middle of winter here. I'm in New Zealand, so yeah, probably the other side of the world from most of you who are listening to this. I'm wearing a ridiculous beanie hat. I've got a very thick, woolly jumper on, actually, that I picked up many years ago in Morocco when we were up in the high Atlas Mountains, and it was freezing then as well, and we hadn't kind of packed accordingly because we were planning on deserts and beaches and that kind of thing where it was baking hot. I've also got a quilt that my mum made for me for Christmas, draped over my lap because yeah, it's a bit of an effort to keep warm. But anyway, I hope that you are well wherever you are. I hope that you're staying healthy in these current times, and I hope that you're a little bit warmer than me as well. But anyway, that's enough rambling. That's enough for the intro. Let's get into today's fantastic question.
Hi, it's Judith, admin at the Canine Conditioning and Body Awareness Group. We get a lot of questions from members on what conditioning or rehab exercises they can do for their injured dogs. Our policy is always to refer them to a rehab professional, so either a veterinarian or a physiotherapist that has extra training in canine rehabilitation. I'm wondering if you could address the risks associated with a DIY plan and why it is necessary for injured dogs to seek treatment under the guidance of a qualified professional.
So this is a fantastic question. So thanks very much for calling in with that, Judith. And if you're interested in checking out her group, the Canine Conditioning and Body Awareness Facebook group, then I'll leave a link to that in the show notes. And I'm sure they'd be delighted to see you and help answer any follow-up questions or other questions you have about that topic. But yeah, I'm really pleased that Judith asked this question because I think it raises a number of important points and things that we all need to bear in mind. So physiotherapy and other physiotherapies for physical therapies, like hydrotherapy, they really do play a vitally important role in the rehabilitation process after either surgery or injury in our pets. Now we think of, I guess, dogs primarily, but cats absolutely can undergo some fantastic physiotherapy exercises and treatments that make a huge difference in their life. And this is after surgery or injury that involves the muscles, the ligaments, the joints, and the bones as well. So that's a huge range of different conditions that physiotherapy can potentially benefit your pet. Now, it is a developing field. It's one that has been developing kind of quite rapidly over the last 20 or so years, certainly since I've been involved with veterinary care from a student through to a practicing veterinarian. And thankfully, it has become more mainstream and recognition has taken place of the really important role in pet care that it does play. And thankfully, as a result of this, demand has increased. And so availability of services is also spreading, and it's more likely to be available wherever it is in the world you live. Certainly when I started practicing, there were not very many physiotherapists that were specifically targeting and treating our pets. So it was actually very difficult to access this service, even if you were really keen. Thankfully, those times have changed. But before we jump into what can potentially go wrong if you just try the DIY aspect, it's important to think of what can actually go right. What are the real core benefits of undertaking physiotherapy treatment with a trained physiotherapist? Well, in the broadest sense of the term, what are the benefits? We can improve the chance of a successful recovery and reduce the risks of side effects. So that in itself is absolutely huge. Who doesn't want to have an increased chance of success after an expensive surgery, for example? And who doesn't want to reduce the risk of side effects? And those side effects can be, things like delayed recovery, but it can also be an increased risk of arthritis and that kind of thing. So they can be quite serious side effects, or serious complications maybe would be a better way of putting it. Physiotherapy also absolutely speeds up recovery. So again, after a muscular injury, it might be that things would improve by themselves with rest and pain-killing anti-inflammatory medication, which is, I guess, our more traditional route of dealing with muscular injuries, for example. But actually, if we add physiotherapy to the mix, then the speed of your pet's recovery is going to be massively increased. And as a result, we're going to get a much better quality of life for your pet and a reduced pain that they're going through. So not only are they going to be in pain or uncomfortable for a shorter period of time, although hopefully we'll be controlling that with anti-inflammatories and additional pain-killing medication, but their comfort levels are also likely to be much better if they're undertaking physiotherapy. And then another thing that's really going to help, the physiotherapy is really going to help with, is to maintain muscle mass. So one of the big problems that we get after any kind of injury or, again, surgery, so a fracture repair, a cruciate ligament surgery after a rupture, is we get a loss of muscle mass in the affected limb. So the muscles, through disuse or through limping and through pain, they atrophy, they get smaller, and actually it can take a really, really long time to then build those muscles back up to where they were before. And if you've got an older animal who's had one of these injuries or one of these surgeries, then actually that muscle may never properly kind of get back to where it was. It may never properly regenerate without that physiotherapy input. So those are kind of the broad benefits as I see them, and there are many more kind of more minor benefits, but they'll fit into those categories. But why can you not then just DIY it? Well, there's some real problems that can happen. The first is that we can actually delay the recovery. So if we're not doing things right, if we're putting extra stresses and strains through areas, through joints, through muscles that aren't able to cope with that, we can actually delay the recovery by causing increased damage to those areas. That's going to potentially then increase the pain that your animal is going through, that your dog is feeling in their leg or your cat is suffering from. And that's obviously the last thing we want to do, is to increase their pain. So actually we can have the opposite effect that we're aiming for. We can also increase the chance of significant complications. Now, an example of this is that I certainly know of one dog in particular whose owner decided to try and increase their exercise and increase what their pet was doing faster than they had been advised to. And as a result, actually, they ended up breaking their leg. Now, that is clearly an extreme example, but it is an example of a significant complication from trying to DIY a rehabilitation plan. Maybe not physiotherapy and doing physiotherapy exercises per se, but trying to increase physical activity and trying to come up with a plan themselves that would ultimately increase the speed of recovery. But we then needed a second surgery. There was a much longer recovery. Thankfully, everything turned out fine. The fracture repair, the initial injury was all good, but we increased the pain that animal went through. We increased the cost of that treatment as well, which is clearly another thing that we need to consider if we're not doing a physiotherapy plan properly. And it was a headache and a nightmare for vet and owner alike. And then lastly, if a physiotherapy plan is not done properly, it can actually cause permanent damage and lifelong problems. So if we've got joint damage, for example, and we're doing things wrong, then it may be that we exacerbate that and we cause more damage, and that leads to a more rapid onset of arthritis, which can have a significant impact on a pet's well-being, on their quality of life, and actually it can impact how long they're with us, because severe arthritis is absolutely a fatal condition and results in euthanasia of otherwise healthy older animals every single day. And I think the desire to come up with a DIY physiotherapy program, that comes from a good place. We recognize that physiotherapy is important, but we don't necessarily recognize some of those potential dangers and damaging effects that not doing things properly can cause. The fact is that we need to recognize that our pets' bodies, they're incredibly complex. The joints, there's a lot of different stresses and strains involved. There's lots of different muscles pulling in different directions. And it's not simply a case of just bending the leg kind of a few times and giving everything a little bit of a rub. There's much more involved with that. And that's why it's so important to consult a trained professional. Now, I actually would definitely not include myself in this, because most vets don't have the knowledge to provide a full physio and rehab service. Extra training is definitely needed. For those that are interested, then there are different training courses that you can go on. Some of those will result in qualifications. It might be that your vet doesn't have a particular qualification, but they're able to provide a certain level of physiotherapy service. They may be able to have a good knowledge on tackling certain conditions, but are not able to treat other conditions. There are trained vet nurses and trained veterinary technicians out there who do a fantastic job of rehabilitating our patients. They've got specific physiotherapy qualifications. There are also trained human physiotherapists, and I certainly a lot of the physiotherapists that I've come across have initially started off down the human track, and then they've switched and trained specifically in dog and cat physiotherapy and rehabilitation. There's also trained animal physiotherapists, so that's all they've done, that's all they've trained up to do, and they are highly trained in that role. So I don't think we can underestimate the importance that good training has, and we shouldn't underestimate the complexity of the body systems that they're dealing with to come up with solutions that are appropriate for your pet, depending on the injury that they're going through. And the way the system tends to work in the veterinary field is that your physiotherapist will work very closely with your veterinarian. There'll be a referral process unless it's all being managed in-house. So your physiotherapist is likely to request the notes from the clinical notes from your veterinarian, so they're aware of the surgery. It may be that there's a telephone conversation that's had as well. Then there'll be an initial consultation, and a plan will be formulated with your physiotherapist. Now, very often in the early stages, that initial consultation is a reasonably long one, because they need to meet you, they need to meet your dog, and the plan is going to be highly tailored to your pet, because every individual is going to be able to do different exercises. They're going to have different levels of training, different tolerances to do certain things. And it may be that they can, for example, if you're used to doing agility, it may be that your dog is able to do more advanced exercises sooner than for a dog who's kind of never done any level of training before, because we're getting dogs to kind of step over rails, kind of trotting poles, balance boards. These can all be exercises where actually we have to train our pet to do them in the first place before they can then get the benefit that they provide. And then also you're going to have regular rechecks with your physiotherapist, but that doesn't mean that you're not doing some level of DIY treatment, because there are going to be, or there are likely to be, exercises that your physiotherapy sets for you to do at home. So there are absolutely things that you can do at home for your pet's rehabilitation, but those exercises need to be prescribed. We need to think of them as a specific treatment, much like a drug needs to be prescribed by your veterinarian, and exercise should be prescribed by your physiotherapist, because they're highly individualized based on your pet's injury and their tolerance and ability to do certain exercises. So that is another real danger if we're just looking on the internet, for example, cruciate disease rehabilitation. it's likely that you're going to come across treatments that really are not suitable for your pet because of maybe the type of surgery that they've had, the repair that they've had, maybe the level of damage that there is, and also their level of training, their level of fitness as well, all plays into what the most appropriate treatment is. So I would really echo Judith's thoughts and her group's advice when people are looking for specific physiotherapy recommendations. Get in touch with a physiotherapist in your area. You're going to be able to find them on Google, but also talk to your vet as well, because it may be that they work very closely with a particular physiotherapist who they rate highly and they have a really good working relationship, because it's all part of teamwork, really. We're a pet health team, and that doesn't just include your veterinarian. It includes your veterinarian, their nurses and technicians, their support staff, but also other treatment professionals, so our physiotherapists, our hydrotherapists, all that kind of thing. We're all one big team, and we're all aiming for a successful outcome for your pet. So talk to your veterinarian or talk to your local physiotherapist about what the most appropriate kind of plan is, treatment strategy is going forward, and I'm sure you'll get the best advice and have the best chance of a successful outcome.
Get your questions answered at callthevet.org.
And so that's it for today's episode. Thanks again to Judith for that fantastic question. Make sure you check out Judith's Facebook group, the Canine Conditioning and Body Awareness group, and I'll leave the link in the show notes. Also, if you haven't already and you're not aware of it, so I've got a free guide about how to keep your pet as happy and healthy as possible in the first place, so that they can live as full a life as possible. It helps prevent some of the most common conditions, diseases and injuries that I see every day as a veterinarian. So if that sounds like a guide that you'd like to get your hands on, you can download it for free over at ourpetshealth.com/petcareguide. And again, I'll leave a link to that in the show notes as well. Also, if you have enjoyed the show, make sure you hit that subscribe button and share it with your pet owning friends and family to help me spread the word and help me to help more pets live their best life possible, which is what I'm all about. So that's it for this episode. Like I said, I'm actually going to be taking a break for a few weeks, so to have a kind of a midwinter or a midsummer break, mid-year break I should call it, depending on where you are in the world, depends on the season. And I'll be back with you again in August for loads more questions. And if you'd like your question answered, remember you can always submit that over at callthevet.org. And so until next time, I'm Dr. Alex. This is Call the Vet. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.